Okay, so today we're going to talk about a very common issue that we see here in a clinical setting, also outside, and when people aren't coming in for a clinical setting looking for help. Maybe they're just experiencing just general low back pain and they just put up with it. So I was reading a little bit about it, and I saw a statistic that about 40% of low back pain is discogenic pain, or caused by the disc in the low back. So what I have here is a model of 3 vertebrae, and in between each of the vertebrae is a intervertebral disc, and that's kind of like the shock absorber and cushion between it. So this would be front, this would be back, and this is like when we bend and move, the bones are going to move kind of over top of each other, but they kind of move on the disc. Okay, so the disc is going to kind of be a little bit fluid and be able to adjust and move. And how that disc is kind of formed, there's 3 parts to the intervertebral disc. There's actually the end plate component of the actual vertebrae where that meets the disc. So between, if there was a disc right here, to be, where the disc meets the actual vertebrae itself. Then the center of the disc, which is more like kind of a jelly-filled donut almost. It's more fluid, more liquid. And then around the outside are very tough cartilage rings. And so what happens with low back pain a lot of times is that vertebral end plate will start to break down due to inflammatory processes. And those chemicals that are released will start to break down the fluid on the inside of the disc. And then as that starts to break down, eventually it works its way towards those rings in the outer parts of that disc, and it starts to work its way back. Typically, a person won't even feel any discomfort or pain or any symptoms with that until it reaches the outer third part of those rings, because that's the part that contains nerves, so that we can actually feel the pain there. So the fluid makes it to that outer third part. That's when a person starts feeling maybe some low back discomfort or low back pain. Ultimately, that disc can continue to protrude and push further back. So there's different grades on how they image it and the kind of distance that it has made it. Ultimately, it can all the way push out and can sequester or pinch off as well. But that's all minor details for what we're talking about. So typically when this disc bulges, it is going to go posteriorly or towards the back, because a lot of the activities that we do are kind of in front of us, like bending and lifting. People not engaging, their hips to bend and lift, they're bending forward in their low back. So this kind of pushes forward here on the disc or on the vertebrae, and it pushes the disc material backwards. Okay, so it's wanting to push out. Another mechanism would be sitting down. So a lot of times when people sit, they're in flexion like this, and what it does, it pushes pressure on the front of this disc, and it's like squeezing a water balloon. That fluid wants to push posteriorly, so it's all kind of going backwards. So I do want to make note of one thing. I mentioned mechanical, so mechanical from sitting or bending and lifting. Not to leave out the fact that this whole process started chemically with inflammation in the body. So it's very important to eat like an anti-inflammatory type diet, as opposed to more pro-inflammatory type foods that are going to set you up for this more so than if you're not. So I just want to put that caveat there. We're not ignoring the chemical component, because that's where it all starts. So for this mechanical process, we have this disc starting to push back. So it may just be local low back pain right there. Or you can kind of notice here that this is where the nerve comes out. There's a little hole there. There's not much room for the nerve in the first place. So if a disc starts to push and bulge back, it can actually irritate that nerve physically, irritate it. And that will give people like a sciatic type pain down the back of their leg into their butt. Maybe it goes all the way down to their calf or their foot or toes. And sometimes maybe it doesn't physically touch it, but it could just be like the inflammatory chemicals that could irritate that nerve. So what we need to do then is push that disc forward push that disc material back forward where it came from. Okay, so we can do some exercises in certain directions and push that material back where it came from, and then avoid sitting, avoid any bending and flexion or lifting, and not allow it to push back out. Because if we push all this material in and then go ahead and sit or flex and bend and push it, we're going to push it right back out again. So we have to push that material in and then take care of our body so we're not exacerbating that and pushing it right back out until those rings can kind of heal back out, inflammation kind of calms down. So we're going to demonstrate some exercises that will push this disc material back where it came from. We're just kind of playing percentages. Everybody's different, the mechanisms are different, what their lifestyle factors are different, but playing the odds, most times it goes posteriorly or back into the side somewhat. So for the majority of cases, this will be very beneficial for fixing someone's low back pain, or at least helping reduce the symptoms. And then you can add in other rehab exercises to kind of help strengthen the core and calm down the inflammation a little bit. That being said, I want to note as well, so we have this disc that's kind of taking care of these compressive forces. Typically when people lay down at night, they're laying horizontally, and these discs become more fluid filled at night. So a person is actually the tallest they're going to be throughout the day first thing in the morning. And I've seen some studies say up to 2 centimeters taller, and then it goes back down within the first hour or so. However, being that much more fluid filled, initially a person's going to be more at risk for that fluid to move backward. So say you get up right away in the morning and you go and sit on the john or go and sit in the chair or something, you're putting a lot of pressure on the front of that disc, pushing it back. So the best thing to do is to kind of do your morning activities while you're standing up and at them, and then if you have to do stuff where you're sitting or bending, try to push that back at least to past the first half hour or so of the morning when your discs aren't quite as vulnerable. So we're going to show the exercises that can kind of help push that disc material back forward and can kind of help alleviate the symptoms. A lot of times, so that those symptoms are coming from the vertebrae and the disc here itself, but a lot of times people feel that pain down into the leg, down into the foot. We need to get those symptoms back up to the back. So a lot of times you kind of ignore the back pain as much as that sounds counterintuitive, but you need to focus on that radiating pain and get that back up. So if a person had pain going down into their foot, or I say pain, but it could be tightness, numbness, tingling, any of the above nerve type symptoms. But if we do some extensions and maybe their back's a little bit more discomfort there, but they don't have any symptoms in their foot and calf, and it's just kind of slightly in their thigh now, that's a good thing because we're bringing those symptoms back up to where they started from the back. So we have to bring it all the way up to the back before we can, and it's called centralizing, before we can fully get rid of the cause of the problem. So we'll show you the exercises here. So typically we'll start off with a patient laying down prone due to the fact that they're not weight bearing. So it's a little bit more comfortable than when they are standing. Because sometimes people, if they're really acute and they can't even get up off the floor, it's super severe. So there's a variety of ranges. Sometimes it's just very general, subtle low back pain that's just more of a nuisance. However, usually we'll start with the patient prone, and typically the symptoms are going to kind of start from the base of the low back, just above the belt line here. And maybe he's got symptoms, we're going to say down the right leg, down to his foot. We're going to kind of pay attention to what's going on with those symptoms. And we'll just have him start and say, Joel, can you prop up on your elbows for me? And sometimes this is a lot, even for a patient to get up this far. Maybe they can't even prop up this far to start off. They may feel a significant amount of pain or tenderness here, but that's pushing that disc material back forward, so it's not always a bad thing. Then we can go ahead and rest all the way back down. Go all the way back down here, so then it takes the pressure, but we're having him come into extension, so it's pushing that disc material back forward where it came from. And so a lot of times when he does extend up, it's going to be a little bit more tender. So go ahead and come all the way up on your elbows again. Okay, so sometimes I'll give patients an exercise at home. They just are reading in this position or watching TV. This is going to be much better because they're in extension than if they're sitting in flexion. So this is good just in this position. Maybe he's been in this position for a little bit. He can have a spouse or significant other or a friend take their hand and provide a little bit of overpressure in the base of his low back here, and or he can use his hands to do a full press up. So he's just going to do a full press up here, really trying to let his belly button sink to the table. A lot of times I'll tell patients when they exhale, really trying to let that belly sink. Good, and then you can go all the way back down. Good, and then go ahead again and press up. So this is a really good tricep workout, and a lot of times you can keep going here, back and forth. A lot of times people's triceps will get sore before anything, but we'll just have them go back and forth and really isolate this low back for extension. And he's doing a good job on his own. He can do these like this at home on his own. Otherwise, he can have someone just provide just a little bit of pressure. It should be pretty comfortable, nothing that's super painful or anything. And after doing maybe 10 or 15, you can take a break. We're going to recheck and just kind of look at what his symptoms are doing. If they were down into his foot and maybe now his foot's better and he's not feeling it as much in his calf, it is starting to come up and centralize. That is a good thing. Sometimes it does become a little bit more flared up while he's doing them with the extension. So that's okay if he feels it at the end range of his extension. But when he comes back to neutral here, after maybe 30 seconds or so, things should settle down a little bit and it shouldn't be lingering pain. That is somewhat of a red flag if he gets done and maybe a few minutes later his symptoms are worse. Maybe they're going down his leg further or more intense. Then you probably want to go in and get evaluated professionally because there could be something more serious going on. Also, with anything like this, if you're experiencing loss of bowel or bladder or anything major like that, you're going to want to go to the ER for that. And kind of the later stages of this stuff is muscle weakness. So if you've got muscle weakness as well, that's probably something you don't want to take care of on your own. You want to get that checked out. So this is just showing the prone press up though. It's very good for low back pain. Sometimes maybe it just radiates across the back. It doesn't have to go all the way down the foot. It could just be down into the glute or back of the leg, but it's very good. And usually I'll tell people 20 to 30 per hour, just because there's a lot of them you have to do and you have to do it consistently. And that's a lot through the day and it gets boring, but they are very beneficial and helpful. And if they are helpful, you don't have to stop there. You can do even more. Go ahead and stand on up, Joel, because people at work, maybe they don't have the opportunity to get down, or maybe it's not as socially acceptable to lay down and drop down and do some press ups. So you can do a standing extension. So I'm just gonna have you turn to the side here and just take your hands behind just like that. And so his hands are kind of isolating to the low back, and I'm just gonna have you bend back as far as you can. Good, and good, yeah, it's perfect. And we don't want him to come all the way up into flexion, so he's gonna make sure he just stops right at neutral like he is. And he's really trying to isolate that extension to the low back. And again, the 20 to 30 extensions per hour, it can be prone or it can be standing. This is a lot easier on the triceps. It's just personal preference and what a patient feels like they like better. Sometimes if you feel it a little bit more on the right side, it's beneficial to kind of go back into the right, or if it's the left, you can kind of go back into the left a little bit and mix that up with a straight extension. But very simple, and that's the extension exercises.